Transgender Medicine Made Simple is provided for your education and interest only. Information on this channel does not constitute medical advice for you or any other individual. My name is Dr. Linda Gromko, and I'm a board-certified family practice doctor in Seattle. I have worked with the transgender community since 1998. When I started my family practice in 1989, I focused on women's health care and delivering babies. But one day in 1998, a transgender woman asked our receptionist, "Does Dr. Gromko treat transgender women?" My answer was not yet, but if the woman is willing to help me learn, and if she understands that I'll be learning as I go, I would be happy to try. Well, we hadn't learned anything about transgender medicine in medical school, nor did we learn anything when I went to nursing school or nurse practitioner school before med school. Even now, there isn't much transgender information that's taught in professional schools today. So, to facilitate my own learning, I talked to the few Seattle doctors I could find who knew anything about transgender medicine. I talked to a number of physicians at the University of Washington, and I read information from the World Professional Association for Transgender Health, also called WPATH. But the most important part of my learning came from attending the weekly support groups at Ingersoll Gender Center. This is a group that's free and meets every week, and it's open to anybody who's exploring issues of gender or their family members or other people who are interested. They had a weekly check-in, and they also discussed a topic of the group's choosing. It was in that group that I learned about the community and the struggles that they and their families can face. For example, I learned about people trying to get medical care, and I learned that it wasn't uncommon for people to be refused care altogether. One patient, for example, was in a small town, and the endocrinologist there simply tore up the medical records that she had brought for the visit. I learned about what people went through when they were transitioning in the workplace. This important support group still exists today, meeting every single week, whether it's snowing or whether it's a holiday, and this has been going on for some 40 years now. Most of all, in that group, I learned that gender transition is not a choice, and it's certainly not a fad or a phase that people go through. I've continued to learn by talking to hundreds of people who experience gender dysphoria over the last nearly 25 years. With my early knowledge of transgender health, I opened my practice to more transgender individuals, and today I treat transgender people from age 5 all the way up through 85. Today, I prescribe gender-affirming hormones. I provide pre- and post-operative care for people who are having gender-affirming surgeries. I place puberty blockers in preteens and teens who are trying to put their puberty on hold. 8 years ago, we added an aesthetic division. We provide both laser and electrolysis hair removal, mostly to clients who are having surgeries and require hair removal before they have their gender-affirming surgeries. My claim to fame in this is offering these usually very painful services with pain medication and local anesthesia. For most of our patients, we provide primary medical care, and we see easily as many non-trans individuals as we see transgender people. Over the years, I've educated myself through attending international conferences through the World Professional Association for Transgender Health. I've become a speaker myself, and I've lectured at the University of Washington School of Medicine, the UW School of Nursing, various physicians groups and community groups, and even to my medical malpractice company. Because I wanted this information to spread further, I have written the following books. I first wrote in 2015, Where's My Book? A guide for transgender and gender nonconforming youth, their parents, and everyone else. During the pandemic, I wrote a practical reference for transgender and gender nonconforming adults. I published part of this book separately as Gender-Affirming Surgeries, Planning Through Post-Op for Transgender and Gender Nonconforming non-conforming adults. And these books are available through my website at lindagromkomd.com, as well as on Amazon and other online bookstores as well. Over the recent years, the political climate has changed dramatically, and it's restricted the availability of transgender medicine. That's one of the reasons why I started this YouTube channel, Transgender Medicine Made Simple. Originally, it was to be for healthcare providers, but now I want good information to be out there for anybody who needs it. Healthcare professionals, aestheticians, educators, and most importantly, for transgender and gender nonconforming people and their families. In short, I wanted the information available to anybody who needs good, reliable information that comes from over 2 decades of first-line experience. I truly want to be a source of truth and to deliver that information in a kind and supportive way, something I believe the trans community may not have felt for some time. If this information is helpful to you, please like this post and subscribe to my channel. Share it with people you know who need the information, and I'll continue to provide solid, reliable information covering a range of topics that are pertinent to trans health. Thank you very much for attending, and I'll see you in the next video.